Good morning, guys. My name's Tony Maritato. I'm a licensed physical therapist, and I have tried to record this video seriously no less than 5 times. Every time I try to record it, I find that I start to babble, I start to run on, and I don't get to the meat of the situation. So this video today is specifically for those individuals that have had a total knee replacement. They're 3, 6, 12 months post-op, and they're still struggling to get the range of motion. I want to share some practical experiences I've had in the clinic treating individuals who have been frustrated by this condition. I want to share some different perspectives that maybe you or your physical therapist have not considered. And I want to hopefully share some encouragement so that you understand your body is never staying the same. Your body is always changing. And just because you don't have the range of motion today that you hope to have doesn't mean you can't have it in 3, 6, 12 months, or even a couple years. So let's talk about, what's the classic scenario? Classic scenario is an individual has a knee replacement. They're expecting to have 90 degrees of flexion, 0 degrees of extension by 4 weeks. They're expecting closer to 120, 130 degrees of flexion between 6 and 8 weeks, but it doesn't always happen. And so I've had the good fortune. I'm a private practice owner. I work for myself. I get to see a lot of individuals who are struggling with different challenges. And the most common challenge is frustration around not gaining the range of motion that they expected. So I'm thinking of a very specific case right now. I'm going to change some of the details just to protect this individual's privacy. But this was an individual who had received the total knee replacement, was very active individual. They were doing things all the time, a young, aging adult. And this individual, after the knee replacement, had completed several physical therapy visits at the surgeon's physical therapy clinic. They weren't getting the kind of attention they wanted. They weren't connecting on, the same level with the therapist that they were looking for. They just didn't feel comfortable. So they reached out to me. They found my YouTube channel, this YouTube channel, and they started therapy with me. And I did the initial evaluation, and I'm going to kind of use some round numbers here, but it had been multiple weeks since the surgery, and the individual was still very, very limited. Let's say 70 degrees of flexion, let's say 30 degrees shy of full extension. So this individual was walking and moving and doing things, but severely limited in the range of motion throughout the knee. And when I start working with an individual like this for the first time, my responsibility as the physical therapist is to try and determine what are the limiting factors. Why is this person not attaining the range of motion that they're looking for? Certainly there's an element within, it could be scar tissue. That's what everybody's going to assume. But you can pretty quickly tell just from personality, just from the things that they're saying, the things that they're doing, whether the person has done the conventional things that should be done. Are they, doing too much? Are they doing too little? Are they doing enough? This individual absolutely was doing plenty. And in my experience, owning a private practice for more than 20 years, I don't know that I've ever met an individual who didn't have the range of motion they wanted, who also was not doing enough, air quotes, enough exercise. They're all doing enough. They're all doing more than other people who have plenty of range of motion are doing. So I don't think that that's as big of a factor as we think it is. But my responsibility is try to establish some patterns, try to listen to the story, try to understand the context. What was the range of motion like prior to surgery? What are the expectations after surgery? And then look at what tissue might be involved in limiting the range of motion right now. Is it a sensitivity thing? Is it painful? If it's painful, it doesn't matter. I'm never going to be able to achieve more range of motion because I'm never going to push past a person's pain tolerance. Is it connective tissue? So yes, it could be scar tissue, but it could also be other elements of connective tissue that are limiting range of motion. Is it fear? Is it anxiety? Is it muscle guarding? And a lot of times I find that those are the bigger factors, whether it's because an individual had a negative experience with a previous physical therapist, or whether it's because the individual doesn't have a good relationship with the orthopedic surgeon. I just find that there's a lot of fear, anxiety guarding whether it's conscious or subconscious. And the way that I assess for this, I'll give you a great example. So the individual that I'm thinking of right now, that I'm sharing this story about, we were able to achieve 90 degrees of flexion pain-free without any aggressive pressing or pushing or coaxing in a very specific position. So I could achieve 90 degrees of flexion in a very specific position. But then once we changed positions, I had this individual now sitting in a tall chair so that the foot was suspended. I was supporting the ankle, and let's just say the knee is resting at about 50 degrees of flexion. So I know that it can go to 90 because we were just at 90 minutes ago. I'm supporting the ankle with the knee at 50. And as I start to move toward 60, 70, 80 degrees of flexion, almost instantly the individual reflexively starts to tighten the quadricep muscle, starts to resist the motion, takes full control of the weight of the leg. And as a therapist, I would, naturally say, it's okay. I'm not going to let it go past 90 degrees. I'm not going to let it go into a painful range of motion. Try to relax. Try to allow me to hold the weight of your lower leg in my hand. But no matter how much the individual tried, as soon as I initiate the movement toward flexion, nowhere near the available end range, reflexively the individual would tighten the quadricep muscle and restrict the motion. And so this is one of those things that there's no level of scar tissue, there's no level of pain. This is all within a pain-free zone, but it's a reflexive response to the movement that even the most aggressive, you push it till you can't push it anymore, that kind of mentality, it does not help this kind of situation. And I can tell you that more frequently than not, these are some of the restrictions that I see within somebody who can't get range of motion. It's not that there's scar tissue. We can't even get to the point that we feel the scar tissue restriction because there's so much reflexive inhibition, there's so much muscle guarding, there's so much subconscious anxiety around the movement. And when I talk to my patient, very calmly, and we're like, hey, what's going on? Why is this? You understand that we're nowhere near your end range of motion, but yet you're guarding and restricted. Almost always the patient will tell me, one, they didn't realize it. Two, it's an anticipatory response. They're anticipating the pain. They're anticipating what it's going to feel like or something is going to be wrong. And so in that anticipation, they automatically tighten and stop the motion. But they're nowhere near the available range of motion that they have. So this would be an example of a situation that really, it's not about doing more. It's not about being more aggressive. It's not about having a high pain tolerance. We're not even talking about pain. Like the individual I worked with yesterday was stopping the range of motion before ever reaching a painful zone. It is a reflex that needs to be reprogrammed in the central nervous system, but you need to have a therapist, a physical therapist that has the time, has the ability, has the resources, the patience, the knowledge to say, look, I understand this is not a typical response. It's not an abnormal response. It's just not a typical response. And so what you, the patient, need is somebody who can sit there and take the time to really dig deep into what is causing the restriction, what is going to be the best way, the best strategy, the best plan for us to overcome the root cause of this restriction. And I can tell you that over multiple decades, we have seen patients, not because of what we were able to do, but because they were able to identify the problem, develop a plan of action to solve the problem. They were all able to at least achieve their goal range of motion, if not exceed their goal range of motion. And I see it almost always in the same way. It seems like for weeks or even months of early therapy, that muscle response is happening. But then something happens at some point, I wish I knew what it was, where the central nervous system calms down and the leg all of a sudden starts to relax. And the individual can give up the control. They can let that limb just relax and hang. And as soon as I see that switch flip, as soon as I see that quad muscle primarily go from tight and rigid and guarded and restricted to soft and compliant, all of a sudden the range of motion just comes like 5, 10, 15 degrees quickly until the person gets to 120, 125, 130 or more. So I just want to tell you that as a therapist, in the clinic for more than 20 years, I've seen a lot of situations. I've worked with a lot of individuals. I've seen a lot of other amazing therapists and what they can do. It's almost never the patient's fault for not gaining the range of motion in these situations. It's more common than not that there's something going on that's just an atypical response to the surgery that requires the patient's knowledge and experience of a therapist who can take the time, who's not rushing you through everything, and who can really allow your body to figure out what it is that we needed to do. So guys, I don't know if that gave you any kind of valuable information. I hope that was helpful. If you're dealing with something like this, I'd love for you to share your experience down in the comments. If you think that there's anything that, you need help with, let us know. I do want to mention, so there's a website, MedicareHomeTherapy.com. It's a directory where you can find physical therapists, occupational therapists who will come to your home. It's covered under the Medicare Part B benefit. It is not home health therapy. These are outpatient therapists who deliver services in the home. Check it out, MedicareHomeTherapy.com. Otherwise, I wish you the best, and I will look forward to seeing your comments. Thanks for watching.